It's March 11th, 2020, and as promised, it's time for an update on the COVID-19 coronavirus situation in Australia. A lot more information's come to light, and here's what you need to know. So, there's a lot to cover. I'll try and keep this as short as possible, but to do it justice, this is going to be a long one. If there's a specific part that you want to see, I'll put a cheat sheet in the timeline below so you can jump to it. But I recommend watching the whole thing to get a complete picture. Let's start. First things first, is this the end of days? Will a few survivors gather around our campfires and whisper of the old times? No. But this will be something that will affect your community in some way, shape or form, and the way in which that happens is something we can help control. The novel coronavirus 2019, or COVID-19 as it's now been named, has spread from its origin in Wuhan, China to over 108 countries and counting. So far we've had 117,000 confirmed cases worldwide, 112 in Australia, and 3,900 deaths worldwide, and 3 in Australia, but with overwhelming evidence to say that there's probably more on the way. We know that, fortunately, children tend to do much better than the adults, with a less than 1% death rate in those under 50. Let's have a look at that graphically. The gold represents everyone infected, but alive. The other boxes represent fatalities, broken by age groups. Fortunately, there's been no reported fatalities in the under 10 age group, but it's clear to see that as you get older, the likelihood of death does increase significantly, with after 50 years of age, there's a jump from 0.4% to 1.3%, to 3.6% when you enter your 60s, 8% in your 70s, and up to 15% when you get over 80 years of age. Likewise, those with pre-existing significant health troubles like cardiovascular disease, diabetes, or chronic respiratory disease, or cancer, will also fall into these higher risk categories, which makes sense given they're also more likely to be older in the first place. Now, these statistics could be altered by a lot of difficulties in the initial data collection, so we'll have to wait and see for sure how things go in Australia. It's reassuring that the vast majority of people will be okay, even if they do become infected. But applying these numbers to a large population does mean that many Australians, particularly the elderly, face trouble and extra attention will need to be given to them. We still don't have anything other than supportive treatment, such as hydration through drips and ventilation to help people breathe, be that through a tube or through oxygen masks. But efforts to produce a vaccine and testing of existing antiviral medications used for other infections is underway. So does this mean that containment has failed? Well, not really. In situations like this, I think we're always expecting international spread, but I don't think the overall number of cases will be significantly different. Instead, containing as best as possible, we're able to at least slow the spread, which lets us do several things. Number one, prepare resources for when it does hit us, and two is to ease the load on healthcare resources while it is hitting us. If you think of this like a graph, which I do because I'm a nerd, the area under the graph represents the total number of people infected. By slowing the spread, you keep the same number of people affected, but the specific number of people affected at any given point is reduced. This means that our hospitals can keep up rather than being flooded with every single case at the same time. So who is at risk? Broadly speaking, there's 3 groups at the moment based on the current WHO and Australian Department of Health guidelines. A patient with a new respiratory illness, fever and at least one sign or symptom of respiratory disease like cough or shortness of breath, and with no other cause that fully explains their clinical picture, and a history of travel or residence in a place reporting local transmission of COVID-19 diseases during the 14 days before symptoms began, or a patient with any new respiratory illness and having been in contact with a confirmed or probable COVID-19 case in the last 14 days before symptoms began, or a patient with severe new respiratory infection, fever and at least one sign or symptom of respiratory disease like cough or shortness of breath, and requiring hospitalisation and with no other cause that fully explains the clinical picture. Now, I very much expect that this shortly will change to only those last 2 options, with more and more countries affected with confirmed cases, and given this is rather an infectious or spreadable virus, the factor of travel will play less and less a role until I wouldn't be surprised if we even stop testing to confirm cases and manage it for simply what it is, a respiratory infection. What is being done to prepare for this is regular updates posted through relevant health departments. For the latest update, check the link in the notes below. And already there is isolation and quarantine of confirmed cases occurring, resourcing and stockpiling of equipment like masks and gowns for healthcare workers, as well as enhanced monitoring programs for high-risk groups and instructions and information being filtered down to frontline healthcare workers. Admittedly, it's not gone as smoothly as it possibly could have, and working in general practice myself, I can say that from my experience so far, assistance and communication from the government has been sketchy, and unfortunately poor, with often conflicting messages. You may have heard the conflict between the Victorian Health Minister and the nation's GPs, and I suggest you check out my other video from my channel to find out what this was about. And so what can you do to prepare? Firstly, stop hoarding toilet paper. The only reason we've run out is because heaps of people seem to have their garages full of the stuff. And so while some people are free to poop until Christmas 2025, many Australians might expect a few extra showers in the near future. In terms of canned goods and long life foods, it might be helpful to have some up the sleeve in case you do need to self-isolate. But water will still run from your taps, and don't forget that online shopping, as well as friends and family, can help bring supplies around if needed. Now, some councils are also starting, along with community groups, to have regular phone calls to isolated people to check on their ongoing physical and mental health. I can't emphasise enough, though, how important it is to regularly wash your hands, cover coughs and sneezes in your arm, avoid contact with people who are sick, and to stay home if you're sick with a suspected or confirmed case. Now, as to what to expect from society, the government's preparing pop-up clinics all across the country, and more information will be out on this in the near future. Ultimately, the way society reacts to coronavirus is in your hands, and while so far fear has been the predominant response, and fair enough, it's all been very scary from the media. By understanding this is a respiratory infection that, for the most part, will make people feel miserable, and in a minority of cases cause further breathing troubles, and in very few, currently in total around 6%, with the greatest risk being in the elderly or unwell, requiring hospitalisation, intensive care, and yes, there is an approximately 3% mortality or death rate. Which brings us to the key points of this video. What exactly can you expect if you get infected? And what should you do? First thing, don't lie to your doctor or clinic. Contact your GP or health provider by phone before going into the clinic so that you can be either directed to a dedicated site or have appropriate safety precautions in place to be assessed. Only the most severe cases where there is serious concern over someone's immediate safety should present to the emergency department. And again, you must phone ahead to find out the safest way to attend. So what symptoms can you expect? Well, there seems to be around a week of myalgia or muscle pains, cough, low-grade fevers, and feeling generally run down. As time progresses, the shortness of breath may worsen if the infection gets down into the lower airways, similar to a pneumonia picture. Well, this tends to happen around days 7 to 9, and is different to a normal kind of flu-like picture, which tends to have a much more rapid onset. Now, this is perhaps one of the reasons why the coronavirus has spread so successfully, because the initial stages you might not actually feel that bad. You might travel around and spread it to others. Again, the best way to slow the spread of the virus is to self-isolate. Contact your health professionals via phone and wash your hands with soap regularly. You don't need alcohol hand sanitizer. Regular soap will do. Coughing into a sleeve or elbow can catch droplet particles. It's also just good manners. Keep hydrated with regular sips of water. You might have a reduced appetite or thirst, and so even if you're not really feeling thirsty, it's probably still to push through it and force yourself to have frequent sips. Let your friends and family know not to visit, or catch up by phone. And you can check with your work if you can actually work by home if you're feeling up to it. This not only will keep your mind active, but can also help give you a little bit of distraction from your symptoms. And finally, keep in touch with others that you know who are also self-isolating, because things can get pretty lonely, and a 5-minute chat could make someone's day. So thanks for enduring this with me today. This channel will be releasing regular health tips and tricks, and updates on coronavirus. So if you like this video, hit like and subscribe, click the bell to be notified of the next upload, and let me know in the comments below your experiences so far with coronavirus. I'm Dr. Kane Treble, and this has been another Long Consult. Catch you next time.